Hello friends! So today I would like to continue our discussion on the strategies for nourishing yin and patterns related to yin deficiency. And in particular today I would like to return to the pattern of heart and kidney not communicating. Xin Shen Bu Jiao. You may have seen this pattern in your clinic many times. Typically it presents with a person who already manifests symptoms of kidney yin deficiency, such as nighttime heat, sweating at night, maybe symptoms of dryness. But in heart and kidneys not communicating, your patient is also going to exhibit signs related to Shen disturbance. Because Shen is Shen, the spirit, is rooted in the heart. And always I like to use my 5-element chart to help me understand what's going on. And as you can see, we have fire, earth, metal, water, and wood phases. And the water phase is represented by the kidney, and the fire phase is represented by the heart channel. And therefore the heart and the kidney channel, they find themselves in a control cycle. And what it means energetically is that kidney water controls heart fire. It cools down the heart fire, not letting it get out of control, but simultaneously the heart fire controls kidney water, warming it up, making it more lively and more energetic. And when when the water phase declines, it cannot control properly heart fire, and then heart fire expands and it starts disturbing Shen, causing inability to fall asleep, waking up during nights, and other symptoms of bad sleep. And then how can we establish that this is the correct pattern of in terms of our diagnosis? Well, of course, we can turn to our tongue diagnosis, and we already know that the tongue image of kidney yin deficiency, because kidney yin deficiency is the foundation of this imbalance, and we want to take a look at the status of the kidney energy first and foremost. And in case of kidney yin deficiency, we're going to see a red tongue with peeled coating, or maybe there are patches on the tongue. Then we know we deal with kidney yin deficiency. But in some cases, you're going to see that both kidney yin and yang are declining simultaneously. And in that case, the tongue may not necessarily be very red, because there is not enough yang energy to generate heat. But in that case, you're going to observe that the root of the tongue is contracting, or maybe there is a dent in the root of the tongue. These are the signs of decline of kidney essence. And then we know that we deal with insufficiency of the water phase, either yin or yin and yang simultaneously. And then when the water phase is unable to control the fire phase, the yang energy of the heart is going to push forward on the tongue, and the tongue is going to look a little bit longer at the tip. Or maybe the tip is going to look red, or maybe it's going to be even a little bit swollen. It will not be very thick or very big tongue, because there is not enough yin energy to make tongue very big and thick, unless there is also an element of dampness present, which is a complication. But purely speaking, in case of heart fire that is uncontrolled, that is not controlled by kidney water, you're going to have exactly that, an elongated, maybe swollen, maybe red tip. And then we can also find another confirmation for this diagnosis in our pulse. We're going to go to the radial artery, the left side, because left side represents the yin in the body, left. And again, we're going to subdivide it into 3 parts. And the most distal part is going to be heart, that's sun. Liver is on the guan. And kidney is going to be the most proximal part, qi. And again, we're going to be very much interested in the deep level of the pulse. And the way I was taught to establish heart and kidney communication is called, the technique is called dynamic pulse diagnosis. And what it means is that instead of statically pressing the radial artery to a certain level to establish the strength or the texture of the pulse, we are actually going to be massaging the radial artery, pushing it to the deep level simultaneously on all 3, the Tsan, Guan, and Qi positions. And then once we are accessing the Yin Qi on all 3 positions, we are going to press even deeper to the bone level on the Tsan position, the heart, and simultaneously slightly releasing the Qi position. And then we are going to do exactly the opposite. We are going to press down on Qi position and release Tsan. And normally, we would expect, as we press down on Tsan and release Qi, there should be some surge of Qi, surge of energy, the substance, in the position we are releasing, in this position, in this context, Qi. And then as we press on Qi and release Tsan, there should be some surge of energy on the Tsan position. And this establishes that, this procedure establishes that both heart and kidneys have sufficient yin to communicate with one another. But in case of heart and kidney not communicating, as we press down on Qi, there will be no response on Tsan. Or when we press down on Tsan, there may be no response on Qi position. And then we know that heart and kidneys are not communicating in terms of the pulse diagnosis. And then once this is established, once we have our diagnosis established, we can proceed to our treatment plan. And heart and kidney not communicating treatment plan is very similar to the treatment plan for kidney yin deficiency, because once again, this pattern is rooted in kidney yin deficiency. And so our first therapeutic action should be nourish, kidney yin. And then our second therapeutic action would be regulate waterways, then we want to strengthen the earth phase. Number 4, we want to clear deficiency heat. So remember, these are exactly the same therapeutic actions that we take when we strictly treat kidney yin deficiency. But because now we are dealing with heart and kidneys not communicating, we are also going to establish heart-kidney communication. I'm using the same character, jiao, for communication. And we want to, of course, anchor yang, as we did in our kidney yin deficiency fire treatment protocol, and calm shen. Do you see that calming shen comes in the very end of this list? And the reason is because once we select points from all of these categories, most of these points are going to be very calming to Shen already, and we don't really need to add more points. And as you can see, our list is quite long, and it's always virtuous to use fewer channels to achieve therapeutic results in order to, first of all, have the benefit of observing the effects of our treatment, and at the same time also making sure that we are sending a very clear message to the body what exactly we want to do and where we expect the improvement to take place. And for this particular presentation, I would like to invite you to meditate on the possibility of using extraordinary channels primarily to treat this condition. And so we're going to use the Sea of Yin, the Zhen channel, as our main conduit for all the therapeutic actions, whichever we can. And of course, to anchor Yang, we're going to use the Sea of Yang Du meridian. And hopefully, the Ren and the Du meridian are going to complete most of the therapeutic actions we require. Let's take a look. We can begin this treatment by opening the Zhen and the Du with the confluent points, kidney 6 and lung 7. And then we can add Zhen 4 to, can you see me? Okay. And we can add Zhen 4 to this formula to strengthen the kidneys. And while lung 7 already regulates waterways, but let's say we feel that there is lots of stagnation, and we want to add another point to regulate waterways, and then we can do Ren 5. If it's not enough, there is more fluid stagnation, we can add Ren 9. Okay. Then to strengthen the earth, we can use Zhen 12. It also regulates qi in case there is bloating and there is stagnation. We can always use this point. Unfortunately, Zhen channel by itself does not clear heat that well, and so we're going to leave this for later. And to establish heart-kidney communication, of course, we can use Zhen 14, the front move point of the heart. And you can see already that so many points here, kidney 6, calms Shen, Zhen 14, calms Shen. And then now we're going to anchor Yang by accessing the Du meridian. So we're going to use the confluent point, small intestine 3, bladder 62. These points also come Shen, by the way. And then we add Du 20. And since we're doing the front part of the body, we can also choose Du 24. It's a great point to calm Shen. And then, just to complete the strategy, we can use the points that further are going to calm Shen by clearing deficiency heat. And of course, we can use kidney 2 and pericardium 8, the fire point on the pericardium channel. It's a great point to clear heat, especially when we feel there is lots of excess in the sun position on the superficial and moderate level. Maybe we can use heart 8. And then we're going to examine, re-examine the pulses. Did our kidney pulse start to surge? Maybe not. and then we can add more points to nourish kidney yin, kidney 3. Maybe we can access gallbladder 25, another great point. You can access it from the front. You want to make sure that the kidney pulse begins to surge, and then you're going to recheck your heart pulses. Do we need to add heart 7? Maybe we need to add pericardium 7, maybe pericardium 6. These are great points to calm Shen, and they're also going to help to flare up the deep level of the left Tsan position, the heart pulse. And from there on, we can re-examine other pulses. Maybe we're going to take a look at the right hand side, and we have Tsan, Guan, Qi, and maybe there is a slippery pulse in the Guan position, the spleen. Maybe spleen is damp because your patient has been compensating by yin deficiency, has been compensating for yin deficiency by consuming either sweets or dairy products to dampen this heat. And so they have slippery pulse, and we want to strengthen the earth even more. Maybe we're gonna add spleen 9, maybe stomach 36, until we see how pulses regulate. And so you can see how this strategy allows us to develop an individual treatment plan based on the individual's presentations in the tongue and pulse diagnosis. So this concludes my presentation for today. I hope you found it helpful. Please try it in your clinic and let me know how it works. And I will see you next time.